Today we are going to be treating Kathleen's skin using our halo laser, and like we often do when we're using the halo, we are going to start it all off with a session of BBL. Kathleen has a history of excessive sun exposure, she has fair skin, and the extent of the sun damage is towards the more severe end of the spectrum. We see these brown spots and patches of pigmentation. There are broken capillaries, which is causing a bit of redness around the cheeks and the nose. There are open pores, there are fine lines, especially around the mouth area. Collectively, all of these signs are the absolute expectation we have of what sun damage looks like as you get on in life. One of the things that we like to do when we're assessing our patients is just to stand back and look at the overall quality of the skin, so that when we're putting together our treatment plan, we are creating something that is really going to achieve an effective rejuvenation for her, so that what she ends up with is a really lovely, healthy complexion that gives her the outcome she wants, rather than just focusing narrowly on the pigmentation in isolation. If Kathleen's main issues were just pigment or vascular changes with more minor texture issues going on in the background, we may well go for BBL on its own. But when the changes are more extensive like this, we need to start thinking about adding in other things, which is why we're doing the halo today. We're going to kick off with the BBL, so let's just recap on what BBL is. BBL stands for BroadBand Light, and it's our go-to treatment for bursting pigments within the skin. It also has brilliant skin regeneration properties, which over time not only make the skin look more youthful, but behave in a genetically more youthful fashion. I always want to add in some BBL because I know that it's going to give us some extra oomph to the results. First of all, we are going to do a couple of base passes where we are trying to get as much light and energy as we can into the skin, which just really helps to start that regeneration process. We're changing the bandwidth of the light that's going into the skin, we're changing the amount of energy we're using, the duration of the energy that's going in, and the amount of cooling that's going into the skin. And we're targeting all of this in this next pass to really break up any brown pigments within the skin. This time we're targeting everything to anything that's red within the skin. So all of the blood vessels, any areas of rosacea, all of these things are going to be helped by the BBL pass. Halo, on the other hand, which is the next stage of the treatment process, is a more intensive treatment that is designed specifically for skin resurfacing. So this is when we're thinking about things like the texture, the pores, fine lines, these sorts of issues is when we want to bring the halo on board. So the way the halo works is that it actually combines two different types of laser. We have one laser, which is an erbium laser, which is taking off only some of the top surface layers of the skin. And the other is a fractional diode laser, which is penetrating much deeper down. It's the dual effect of that superficial treatment and the deeper treatment that gives halo the edge in terms of the results. The halo laser is a little bit more uncomfortable, but we're going to go at it pretty strong, and we're going to do an extra pass, especially around the mouth area, to try and get us as much improvement in those lines and wrinkles as we can. And we really just want to maximize what we can get out of this for Kathleen today. So after we've finished the BBL, we're applying the numbing cream to numb the skin before we then start going with the halo. One of the things that I really love about this system is the level of precision that they are able to deliver. The system allows us to accurately determine exactly the level of depth of ablation we want to achieve, the exact depth of penetration we want to achieve both at the surface and deeper down, It then allows us to measure precisely the size of the individual patient's face so that it can calculate exactly the amount of energy that needs to be delivered in order to achieve those effects that we want to see. That's a level of precision that I have never seen in any other laser manufacturer.
Good, and then turn your head to this side. Yeah, I think you're going to get a really nice result.
So now that we've got it all marked up and measured out, it's just a case of moving the probe backwards and forwards over the treatment area until we get to the endpoints. And one of the really cool features of this system is that it has an inbuilt sensor that detects how fast the doctor's hand is moving. So if the doctor starts moving faster, it starts delivering the energy faster. But if you start moving slower, it slows it down, ensuring that we get consistent energy delivery to all different parts of the face. Now that we've done the face, we're going to go back over the perioral region again, just to really target that problem area for Kathleen. And you know, this varies from patient to patient. So for Kathleen, her problem area is the area around the mouth. So we're going to go super strong around here. Other patients, it might be that actually they've got a lot of sun damage and crepiness on their neck or chest or arms, and we can treat all of these different areas too. When we start the treatment, the intensity of discomfort is pretty mild, so it's like maybe a 1 or a 2 out of 10. The intensity does start to pick up and it becomes a little bit more spicy as the treatment progresses. By the time you get to the end, I would say that the intensity of discomfort is probably around a 6 or a 7 out of 10. It's pretty uncomfortable, but it's not an unbearable level of discomfort, and it fades pretty quickly after the treatment. Usually within the first hour, your face almost feels back to normal, where there is no more discomfort. You just start to see the swelling and the redness begin to develop. It is bearable and totally worth the results. When the treatment is over, there is some discomfort. It's a really intense warmth that probably lasts for maybe 30 minutes to 45 minutes. And I remember when I had this done myself for the first time, and the people from Sciton said, it's gonna go really quickly, and I thought there is no way this is going anywhere quickly, and then all of a sudden, after about 45 minutes, it did disappear. So the discomfort that you experience afterwards generally is pretty short-lived, and then it's just a case of waiting for the redness and the swelling to evolve. And what typically happens with that is that it gets worse in the second day, worse again in the third day, and then it starts to improve. The amount of downtime that you have will vary from person to person, depending on exactly what we choose to do. For most of our patients, I'm expecting you to have downtime of between 5 and 7 days. Now, you will see online some people promote the halo laser as a 2 or 3 day downtime, but the way you achieve that shorter downtime is by reducing the amount of energy you're putting into the skin, which therefore means you're also reducing the amount of benefit you're going to receive. Our philosophy here is, if we're going to do this, let's do it properly, book out an adequate amount of time, and 5 to 7 days, you should be good to go. When that initial healing period is over, in 5 to 7 days, you will notice some immediate improvements in your skin. They talk about the halo glow, and that is definitely something that we see, but the results do get better, and that's actually something that I have noticed more with the halo laser than I have sometimes noticed with other lasers in the past. So you definitely do see that initial short-term improvement, but it does get better over the first 2 or 3 months. Patients are usually happy after a week, but they're delighted at 3 months. After we've got you healed from your halo laser and we've got your skin quality improved, we want to keep you at this new elevated level of skin quality, so we need to do some maintenance. And the way that we recommend you do that is by coming in maybe twice a year for a single BBL session. And that's just a really nice, gentle way of maintaining the results that you've achieved and keeping your skin health at that level that you want to be at. Any questions or suggestions for future content, please pop them in the comment section and don't forget to like and subscribe to our channel.